Hello, everyone. My name is Kendra Mickens, and I'm going to be presenting an unfolding case study to you on preeclampsia. This is going to be for Dr. Foreman's class in advanced pathophysiology. We're going to start off with a little background to the case, which is just going to talk to you a little bit about what preeclampsia is. Preeclampsia is actually a disease process that is actually unique to pregnancy. The process is actually very similar to chronic hypertension, but it follows a slightly different path. When we look at this particular disease process, we actually talk about different things such as chronic hypertension, which we typically associate as a consistent blood pressure of at least getting into the 140s over 90s consistently. And preeclampsia is a little different in that area. When we look at preeclampsia, it is a condition that can also involve seizure involvement, as well as lysis of the red blood cells as it progresses, elevation of liver enzymes, and decrease in platelets. When we look at preeclampsia, it's a disease process that typically, a big difference between it and chronic hypertension is that it typically occurs in a woman who did not have a previous history of any blood pressure issues. When a woman does have a history of chronic hypertension prior to pregnancy, as those blood pressures continue during pregnancy, she's actually diagnosed with something called superimposed preeclampsia. Preeclampsia, on the other hand, does not appear until after the 20th week of pregnancy. What makes preeclampsia slightly different from gestational hypertension is that typically with preeclampsia, there's also going to be proteinuria, where there's going to be spillage of protein into the urine. This topic was chosen because maternal mortality is a very real issue that we have to deal with in pregnancy. And when we look at it, maternal mortality is actually going to be associated with elevated blood pressures, and it is actually the second leading cause of maternal death, When we look at it again, preeclampsia is a progressive condition, potentially. There are plenty of women who do make it to term or 40 plus weeks without having to be delivered prior to that. But unfortunately, there are some women who, as this disease process progresses, will have to be delivered earlier.